we recommend folks stay on Suboxone for at least a year. I tell my patients maybe try to get 2 Christmases under your belt. Let me take you through the research explaining why we make that recommendation. There's been some good research in this area. These studies all indicate that patients with opioid use disorder who take buprenorphine for 1 to 1.5 years have better health outcomes, including staying off opioids, not going to the ED or the emergency room, not being hospitalized, not overdosing, and most importantly, staying alive. In fact, some studies have shown that 80 to 90% of patients who only take buprenorphine for a few weeks actually return to opioid use within a month. So one awesome study, Keiko and colleagues did this in 2003 in Sweden, and they showed that when patients with heroin addiction received buprenorphine for 1 year with counseling and therapy, 75% remained in treatment, and 100% of those patients were still alive after 1 year. But the patients in that study who did a 6-day buprenorphine taper, and then they continued on placebo, at the end of 1 year, 0% were still in treatment, and actually 20% had died, presumably of an overdose. The second study I really want to bring up, Ling and colleagues performed this big study in 2009 across multiple sites in the US. And they compared patients with opioid addiction tapering off Suboxone over 1 week versus just 4 weeks. And guess what? There really wasn't a difference in opioid abstinence at 1 month and 3-month follow-up. The takeaway there is that even after tapering 3 months later, nearly 90% of patients return to opioid use after just 1 to 4 weeks of Suboxone treatment. This is probably the most common question that I get. And it's probably the most frequent discussion that I have with patients who are already stable in their opioid abstinence and in their recovery. So historically, when providers first started prescribing buprenorphine and Suboxone for treatment like 10, 20 years ago in the US, it was frequently used as a short-term detox medication to help patients taper off their opioids. People were prescribed Suboxone for a few days to weeks, and then they were instructed to taper off. But the big question was that too soon? For most people, a quick detox off of opioids using Suboxone and then stopping Suboxone right after is actually inadequate. I mean, personally speaking, a good portion of my patients who are on Suboxone actually got off Suboxone before, and they tapered too quickly after going to rehab or a detox facility, and then they ended up returning to opioid use. There were actually some bigger studies looking at population level data, looking at Medicaid claims. This is for like millions of patients. Patients on buprenorphine for 15 to 18 months compared to patients on buprenorphine for 6 to 9 months had significantly lower odds of visiting the emergency room, getting hospitalized, filling opioid pain prescriptions, and overdosing. In the state of Pennsylvania, patients who were maintained on buprenorphine for 1 year had a lower risk of hospitalization, of visiting the emergency room compared to those who stopped buprenorphine after just 3 to 5 months. So the bottom line here is that on average, longer periods of buprenorphine or Suboxone treatment lead to better outcomes. Research, it talks in broad strokes, right? It's based on studies using averages, probability, risks, and odds, right? So none of it says 100% of patients on Suboxone for 1 year will be abstinent. Nor does it say 100% of patients who taper off Suboxone after 1 month will return to opioid use and overdose, right? Every person is different.